Yeah, because we talk about delivering great results, but you can't do that if you're unsafe. So it's really that intersection of those two things, top level safety and excellent results.
Yeah, and it's all part of the team, right? So, like for instance, like when we operate, oftentimes we operate together because it allows us to operate in a more effective fashion, right? So instead of operating for 8 hours, we're able like to decrease the surgery in 4 hours maybe, because there's 2 surgeons working at the same time. Another thing is like the anesthesiologist is really a complement of what we're doing, right? Because we need to keep them informed, and for us it's extremely important to work with very qualified people. And same thing for our staff here, right? So Leslie, that helps me during surgery here, she's like top notch, and I couldn't do those without her, so that's really important.
Yeah, we do get that feedback a lot. We're big, even if we're doing something under light sedation or general anesthesia, we're still using local anesthetics in lots of different ways, and anesthesiologists love us for it, because the more we can minimize the amount of anesthetic that they have to give, the better kind of everybody does. And so philosophically, that's a big thing for us. When we're doing a facelift, the patient is localized. Even when we're doing an abdominoplasty, when we work on the fascia, that can be really sensitive, but we're very specific about the blocks that we apply for that as well. And that makes the anesthesiologist's job better, and it makes the patient much happier because the recovery is so much easier.
Yeah.
Less nausea, less pain.
Yeah.
It's a big deal.
Yeah, there's different type of local anesthesia, like you said, right? There's lidocaine, Novocaine that you heard all the time when you go to the dentist. There's Marcaine that gives you more 4 or 6 hours. Every certain procedure is sufficient. And for abdominoplasty, there's another one we use, Exparel, which is liposomal bupivacaine. So it relieves that local anesthesia for like 72 hours. So 3 days of pain relief. And since we've used that, our patient actually doing a lot better. But then
Much faster.
that makes our job more complicated. We need to tell them, please do
Take
not
it
do
easy.
anything. You're doing great. So, but that's a good problem to have.